I am Dr. Peter Lopez, the Program Director of the General Surgery Residency. We have a 5-year general surgery residency program here, and we take 4 categorical residents a year. We have no preliminary spots.
I was a 4th-year medical student rotating at a different hospital, and I met a surgical resident from Henry Ford Macomb that was rotating through on an away rotation. And I was incredibly impressed by not only their knowledge, but their operative skills in the operating room. And so that piqued my interest in this program. I did have the opportunity to rotate here as a medical student, and was further convinced by the residents' preparedness for being ready to practice as soon as they finished their 5 years of residency.
I picked Henry Ford Macomb out of all the other ones, partly because of the early operative experience that you can get at Henry Ford Macomb. I also felt I would get a great basic surgical knowledge, which I can take anywhere and translate to any other field.
The thing that really drew me in was on interview dinner. It was very relaxed, and these people seemed like people I could actually spend a lot of time with.
So I actually did an audition here last year, and really it was the people, the attendings, the residents, just got along really well with everyone. I feel like I really fit in.
It's a very good learning environment. Another perk here for the surgical program is we get a lot of early operative exposure in the operating room. I feel like helps facilitate your growth as a surgeon.
Meeting the people and hearing about the program, actually in the interview process, something about it just felt right. It felt like I clicked and meshed with these people well.
Our curriculum changes every year to help the residents be successful at what they pursue. We evaluate every rotation that they do, and we also have a very strong robotic curriculum.
The interplay and the working relationship between different departments, from the ER to the internal medicine department, both of those have been just great experiences for me.
I think our attendings give us a lot of autonomy, obviously autonomy for the appropriate level, but as we become more senior residents, we have the opportunity to make a lot of decisions about patient management, and we also get a lot of autonomy in the operating room.
I think here everyone kind of looks out for each other. I think that there's just a lot of camaraderie, which is what I saw in my audition, and that's going to stay true as a resident as well.
You have a good relationship with the attendings, and the attendings care about your education and want you to get better and are willing to take time with you to help you improve.
One thing that's very, very important is who you are with and the people that you're surrounding yourself with, and your gut feelings most of the time right. I would say 95% of the time is right. So if you're ever in a situation and you don't know exactly what to do, trust your gut, trust your feeling, trust the people around you.
We are a general surgery residency community program. Our residents have a lot of opportunity to do research. Their scholarly activity includes book chapters, local presentations, as well as national presentations.
Going into interviews, you just really need to be yourself, and you need to try to evaluate how you fit in with the program, because like I said before, you're going to be spending 100 hours a week with these people no matter where you go, and you want to make sure that you make your life as easy as possible, because surgery residency is really hard, and you have to do the things you can to put yourself in the best position to succeed. And I think the first thing that you can do is be yourself on interview day.
But my biggest piece of advice is to have something that you do outside of residency, like a hobby, an activity, family. And that will keep you sane during the 5 years that you're going to spend here.
Just work hard. It's going to be tough. You're never going to think you're doing anything right, but you are. Just take care of the patient, do the right thing, and you guys will be all right.
Definitely take a look at yourself to see if the program that you're going to here at Henry Ford is a good fit for you. I think the fit is what is very important, kind of assessing what you value, and if Henry Ford Macomb offers all that, which you know well, then come here.
See if you actually are able to come into this place and learn. See if this is the type of program that you need. And of course, if you all have any questions, concerns, whatever about this program, Dr. Lopez or any of the residents here would be more than happy to answer.
Again, thank you for giving your time and listening to our video. I hope this was informational. If you need to reach out and contact us, feel free to do that.